Hi friend, I'm a Dr. Mintu Kumar Misra. Again, I have one chapter, one class related to cancer. After so long time, I'm going to give lecture on cancers. So cancer is a group of disease, you know that, entire things you know, characterized by uncontrolled cell growth and the potential to spread to other parts of the body. It's not just one disease, but rather a collection of over 200 diseases that can affect any part of the body. Normal cell growth and death are disrupted, leading to the formation of abnormal cells that can invade and destroy healthy tissues. It always attack on healthy tissue. Key characteristics of cancer. So friend, I will talk about uncontrolled cell growth. Cancer cells divide and multiply at an accelerated rate, forming tumors. Invasion and metastasis. Cancer cells can invade nearby tissue and spread to other parts of the body through a process called metastasis. Abnormal cell behavior. Cancer cells often have altered characteristic compared to normal cells such as uncontrolled proliferation and resistance to cell death. So friend, I'll talk about types of cancer. So you can say that carcinoma, sarcoma, leukemia, lymphomas, like that you can talk about that. Carcinomas, cancer that begins in epithelial tissue like skin or the lining of the organs. Sarcomas, cancer that develop in connective tissue like bones, muscles and cartilage. Leukemia, cancer that affect blood forming cells in the bone marrow. Lymphomas, cancer that starts in the lymphatic systems. So friend, now I'll talk about causes and risk factors. What will be the risk factors? What will be the causes? So friends, genetics. You can say that people can get from their parents. That is called genetics. Some cancers have a hereditary component. Environmental factors. Exposure to carcinogens like tobacco, smoke, certain chemicals and radiation can increase risk. Lifestyle choices, diet, physical activities, and alcohol consumption can also play a role. Age. The risk of cancer generally increases with age. Biological traits. Cancer cells exhibit characteristics like uncontrolled proliferation, resistant to cell death, and the ability to induce angiogenesis, growth of new blood vessels to feed the tumor. Diagnosis and treatment. So, friend, diagnosis, cancer is diagnosed through various methods, including imaging, CT scan, MRI, etc., biopsies, and laboratory tests and laboratory tests. Now I'll talk about treatment. Treatment options vary depending on the type and stage of cancer and may include surgery, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. So friend, while cancer can be a serious and life-threatening disease, early detection and advancements in treatment have significantly improved survival rates. So you can make her survival rate high. So friend, this is the lectures. Thanks to my viewers. Love you all.